Jessica Dale is an 18-year-old Caucasian female with no past medical or surgical history who comes in requesting birth control before she leaves for college. She does not currently have any symptoms or pain and reports that nothing is currently wrong. She does report some lower abdominal pain when she is menstruating, but otherwise is fine. She has no allergies and does not take any prescribed or over-the-counter medication. Her father has skin cancer and her mother has asthma. She currently lives at home with her family, but will be moving to the dorms in a few months at her college. She has never been tested for STIs, nor does she perform self-breast exams. She does not smoke, drink alcohol, or use illicit drugs. She is up to date on immunizations. She has no recent weight changes, but is concerned about gaining weight with contraception. She denies fatigue, fever, chills, or any changes in energy level. She denies any delayed skin healing, rashes, bruises, bleeding, discoloration, or any changes in lesions or moles. She denies needing corrective lenses and denies any visual changes. She does not have any ear pain, hearing loss, ringing in the ears, or discharge. She denies any sinus problems, dysphagia, nosebleeds, dental disease, hoarseness, or throat pain. She denies any lumps, bumps, or breast changes. She denies HIV status, bruising, a blood transfusion history, night sweats, swollen glands, increased thirst or hunger, or any cold or heat intolerances. She denies chest pain, palpitations, or edema. She denies coughing, wheezing, dyspnea, or a history of pneumonia or TB. She reports having lower abdominal pain while on her period that includes digestive issues. She denies hepatitis, hemorrhoids, eating disorders, or black tarry stools. She denies any changes with urination, including urgency, frequency, burning, or changes in the color of her urine. She denies back pain, joint swelling, stiffness, or history of fractures. She denies ever fainting or having a seizure, numbness or tingling, or blackout spells. She denies depression, anxiety, difficulty sleeping, or suicidal ideation. The patient's vitals are as follows: temp 97.9, heart rate 69, BP 112/62, respiration rate 16, and O2 sat 99% on room air. She is 125 pounds and 5'6". The patient is not in any acute distress and is A/NO times 4. She maintains eye contact and answers questions appropriately. Her skin is warm, dry, and intact with no visible lesions or areas of breakdown. The patient has a nose ring and acne along her jawline. Pupils are equal and reactive to light, face is symmetrical, ear canals are patent with bilateral TMs, pearly gray, and positive light reflex. Nasal mucosa is pink with normal turbinates and no septal deviation, and oral mucosa is pink and moist. No palpable thyroid mass or lymph nodes are noted, trachea is midline, and head is normal cephalic. Teeth are also in good repair. S1 and S2 are heard clearly with a regular rate and rhythm. No murmurs or clicks are heard. Cap refill is 2 seconds and pulses are 3+ throughout. There is no edema noted. The patient's lungs are clear to auscultation and percussion bilaterally. Respirations are regular and easy. Non-productive cough is noted. Abdomen is soft and non-tender with bowel sounds present in all 4 quadrants. No palpable masses, nodes, or nipple discharge to either breast. Breasts are free from tenderness, dimpling, wrinkling, or discoloration. Speculum exam performed and cervix is without lesions. No visible discharge or blood in the vaginal vault. Uterus is anteverted, mobile, and non-tender. Range of motion intact with no joint pain with palpation. Digital rectal exam reveals no masses and a good sphincter tone. Pulses are present in all extremities 3+ bilaterally. Her first differential is hormonal acne because acne along the jawline is a common pattern seen in patients with hormonal acne. The next differential is dysmenorrhea, also known as menstrual cramps, because it is defined as pain associated with menstruation. This patient is experiencing some lower abdominal pain during her period. The last differential is contraceptive management because this patient verbalized that she is seeking birth control. We ran a beta quantitative HCG test and urine pregnancy test to rule out pregnancy, and both were negative. We also ran a KOH test to check if her acne is caused by fungal infection, which was negative. We tested for COVID with an NAAT test, which was negative, and finally ran a urinalysis that came back negative. Her final diagnosis is an encounter for contraceptive management and hormonal acne because she is seeking contraceptive and she prevents with acne along her jawline. This patient was ordered a continuous monophasic combined hormonal contraceptive pill. She was also advised to take NSAIDs and use a warm compress for menstrual pain as needed. She was educated on safe sex practices, including condom use. She was also educated on when a pap smear is needed and STI testing. This patient will soon be a college student and may begin to participate in high-risk activities, so she was also educated on alcohol and drug misuse. No referrals are needed at this time, and a follow-up appointment will be needed in 1 year, but the patient was encouraged to call and follow up in a few months to see how the contraceptive was working out for her or for any questions.